universe. You are on the maiden voyage for YCCA's Hammer Time podcast, our very first podcast ever.
Numero uno.
Numero uno. And our guest with us this morning, Miss Jamie Luedeman. She is our podcast
diva,
and she's experiencing our Hammer Time live. So
Hi, everybody.
We thought we'd bring somebody sane into the mix, so that's what we brought you.
Because we really don't know what we're doing. And more importantly, I wonder how we look out there.
We'll find out.
Sooner than later. So welcome to Hammer Time, YCCA's Hammer Time. Okay, you guys, I've got a joke for you.
Okay.
Universe, we have a joke for you. So, at a dinner table, there's a dog, a sheepdog, and a lamb. Bah.
Okay.
Is that bah?
Uh-huh.
Bah.
I got it.
And the dog says to the lamb, "What do you mean I'm too controlling?" And the lamb looks at the dog and says, "You heard me. H-E-R-D.
Controlling to the max.
Pretty funny, huh?
I got it.
Get it? Okay, you've heard our joke on Hammer Time. So we have with us Miss Jamie Luedeman.
Hi.
Jamie is an RN and a infusionist,
Yes.
injectionist, injector.
Injector, infusionist.
And we're going to talk this morning about something that's really big and taking the world over by leaps and bounds, IV therapy.
Yep.
You know, you see that a lot in sports, but it's bigger than just sports. And today, Jamie's going to inform everybody about how this is really applicable to the general public.
And how it can make us healthy and keep us on our toes and make us feel better, right?
And recover in certain instances, which Jamie will get into later.
I hope, Mike, you have left all of those instances behind you.
Me too.
So when we come back from our short break, we will get involved with Miss Jamie. We're going to talk about IV therapy, what it is, why we should do it. You should do it just because, right?
Yeah, you should. Keeps you healthy.
Perfect. So stay with us. We're so happy to have you on air.
Thank you. Glad to be here.
Thanks. Mike, roll us off to a break.
It would be my pleasure. You're listening to Hammer Time, brought to you by Yavapai County Contractors Association, and aired on Talk of the Quad Cities, KQNA 1130 AM, 99.9 FM, and in Prescott Valley and Cottonwood, 95.5 FM. So please stay tuned for some great messages from our valuable sponsors. Fill up that second cup of coffee, and we'll be right back.
Hey, good morning, everybody, and welcome back to Hammer Time, brought to you by Yavapai County Contractors Association. Our guest with us this morning is the most beautiful Jamie Luedeman. She's an RN. She is the owner of a Better You IV bar, and we're going to talk about IV therapy. What is it, Jamie, that you do that makes us healthy and happy?
So IV therapy is a way to get vitamins, fluids, minerals directly to your bloodstream. You can take vitamins the oral route. Your body only absorbs about 40% when taking oral vitamins.
Wow, I didn't know that.
I didn't either.
Because it has to go through your digestive system, goes through your stomach, your liver, and then it goes to your bloodstream and your cells. When you take it via IV, it goes directly to your bloodstream and into your cells.
Right into the arm.
Yep. So it's a quick way to get rehydrated or get vitamins and minerals that your body's lacking.
So how would one know what types of minerals we're lacking? Do I come to you and I say, "Oh, Jamie, I'm feeling so tired." What would you inject me with?
Well, if you're tired, I'd probably give you some B12.
Okay.
We have different infusions that we offer depending on what your symptoms are. And sometimes you might feel perfectly healthy and you just want to get an infusion just to continue to stay healthy and make sure your body's getting what you need.
How long have you been into the IV therapy world?
Well, I just started this in December of last year.
Oh, wow.
It's always interested me. Just being a nurse, I see patients come into the hospital dehydrated, and it can cause all kinds of problems with your body. From, you can get bladder infections, kidney infections. I'm a nurse in labor and delivery, so it can cause you to go into preterm labor.
Wow.
All kinds of things.
I had no idea, and I'm sure our listeners didn't either, that those vitamins that we take in the morning, only 40%.
That blows me away. I had no idea.
I had no idea.
So, and the idea of, because the first thing I think of with getting bagged, if you will, is dehydration.
Right.
And so certainly that's what you see a lot of times in the sporting world, and whether it's cyclists or football players or what have you. But for those of us that are ordinary people, we certainly can get dehydrated. And as you said, that can lead to a lot of different other complications.
Right. Can lead to migraines. I mean, all kinds of things you don't even think about.
So there you go. It's not that I'm a pain in your migraine, it's that you're dehydrated.
That's the problem. I'll get dehydrated and you will no longer be a pain in my migraine. Are there various formulas that people choose from? What if they don't have any idea and they want to try the IV bar?
Then we can go over, like every time somebody books an appointment or calls, we go over their history.
Okay.
If they're having any problems or ailments, and just kind of go from there and find the best infusion that would meet their need.
So is there an infusion that will stop my love of carbs?
Nice try, Sandy. Nice try.
Please tell me there is.
Not necessarily.
Darn.
I did notice on your card, though, that you've got different things such as improves immunity, fights illness, detoxification. So talk to us about the immunity, different types of immunities that you can address.
Yeah, so for immunity, the infusion that I do, and every infusion clinic is different, has different things in their infusions, but I do vitamin C, zinc, everything that people take orally, vitamin B complex, which helps increase your immune system, and vitamin B12. The vitamin C, everybody knows that that's what you take when you're sick, and just goes right to your bloodstream and helps.
Bingo.
Yeah.
How often then should someone come in to get an energy boost or an immune therapy injection? Once a week, once a month, once every couple weeks?
I mean, you can do it every week. You can do it every couple weeks. I always just tell my clients, just see how they feel. If they're traveling, they might want to come in and get an immune system booster before they go on the airplane or go on vacation.
Wow.
If they have a bunch of events coming up, just kind of helps boost their immunity.
So here you talk about the immunity boost, and like you just said, pre or post travel. And here's another good one for our listeners out there: pre or post surgery.
Oh, great
think
idea.
About that.
Great idea.
Yeah, vitamin C has so many benefits that people don't think about or realize. It has anti-inflammatory properties, so it has actually been known to kill cancer cells. Helps with inflammation.
What about, here's another one called, I don't need this one, the energy boost. That could be very dangerous. Don't you think?
Give you a little bit more energy.
I don't know what the guys would do with me, Jamie. It has IV fluids, it has vitamin B, it has B12, and amino acids.
Mm-hmm. Yep, amino acids are good even for athletes. Say you're coming up doing the Whiskey Row marathon or half
Okay.
marathon. You can do the energy boost.
Oh, I like this energy boost. It says, and helps to burn fat. That's the one I want.
Yep, helps with endurance, increases your energy, helps with metabolism.
So it winds you up like the Energy Bunny is what it does.
Oh, yikes.
Jamie, how quickly will people, let's just take the Energy Boost, for example, how quickly do they feel any
Right.
difference?
I have people leave my office feeling better when they leave,
Okay. So it
especially if
can
they're
be-
lacking something or if they're sick. I've treated a lot of clients with COVID, and usually we do the Myers cocktail on them, and they leave feeling better, more clear. If you have a migraine, we do the migraine infusion,
so it
and a lot
can
of times
be
they leave
almost
feeling,
immediate.
yeah.
Terrific.
So here's the Myers cocktail, and it has, now when it says IV fluids, what does that mean? Because that doesn't have a vitamin description to it.
Right, it just means you're getting the extra hydration too.
Oh, okay. So you're getting magnesium chloride. I thought that's what you were not supposed to put on concrete.
No, that's potassium.
Oh,
Chloride.
okay, got it. Okay. So it has magnesium chloride, glutathione, vitamin B complex, vitamin C, and vitamin B12.
Correct.
Ooh, that's a pretty powerful infusion.
Mm-hmm. And the Myers cocktail is kind of the go-to for anything.
Oh,
That was actually created by a doctor named John Meyer back in the 1950s, and he came up with that infusion to treat like fibromyalgia,
Wow.
yeah,
chronic.
that's what this
chronic
says. Oh
conditions,
my
yeah.
gosh. Colds, flu, viruses, and much more.
Yeah, that one's good for asthmatics, and that's why it's helped COVID too, because the magnesium helps open your airways.
I think I want to try one of these. You should have brought the infusion bag and we could have done it on air.
We could have
There you
gotten
go.
wound up
I
by
always
the
have
end
it
of
with
this
me.
program.
So how long, when we come back, I want to talk about the length of time, how long it takes, and can you come to offices?
Yes,
Perfect.
I can.
Good questions.
So listeners, we'll be right back. We're going to take a short break. Our guest with us this morning is Jamie Luedeman. She owns a Better You IV bar. We're talking about IV therapy this morning. So be sure and stay with us. We'll be right back. Good morning, universe. You're back on air with Hammer Time with my wingman, Mike. Yay, Mike, wave. Show them where you are. Our guest, Miss Jamie Luedeman. Yes, she's owner of a Better You IV bar. And of course, me, Sandy, your YCCA girl. So we're talking this morning about IV therapy, what it is, how it works, why you should get injected. Whoa. Does it hurt? No.
I mean,
It's like having
it feels
blood
like
drawn.
a little poke.
Okay,
Yeah. Yeah. And then when you take the tape off afterwards, I think that hurts worse.
Okay.
Especially if you have hairy arms.
So how long do you sit there? Now you have an office.
I do.
Share with our listeners where your office is.
My office is 8100 East State Route 69 out in Prescott Valley. I also do mobile.
Oh, you can come to the office.
I can come to offices. I can come to your house, wherever you are.
How long does it take from start to finish when we decide what type of therapy to use and you do the first prick? Does the injection take for everything to filtrate through?
About 45 minutes.
Okay.
Yeah, about an hour total, the whole process. Just, I like to sit and talk to you at first to find out what you're wanting to treat, what infusion we're going to do if you don't already know, and then do paperwork, get your IV started and your fluids going.
Would it be fair to say, to equate it to giving blood? Very similar as far as the needle going in, the tape on?
Yeah, it's a
except that
much
you-
smaller needle.
Yeah, there you
Yeah,
go. There
yeah.
you go. Yep.
The needle size that you do to give blood is pretty big.
Yes.
I use a really small needle size. So
Good to know.
a lot of times people say they barely feel it.
Now, you said that sometimes, Jamie, you come and you have conversations at first to decide what type of therapy they should take. Do you like bring a toolbox and a suitcase full of therapies and you're mixing the cocktails? Or are they all bagged and ready to go?
If we know what you're getting, then yes, we like them ready to
Okay.
go when we come to you.
Now, but if we don't, do you have the little vials and you pour it all together and shake it up and
Yeah, then we can customize anything.
okay? Do the therapy products have to be refrigerated?
Some of them do.
Okay.
Yeah, some of them have to be refrigerated, others don't. So it just depends on what it is.
I just find this so fascinating, Mike, don't you?
I do, and this might sound a little funny, but we used to have to give an IV to one of our cats
Oh,
to hydrate them.
Mhm.
And I'm sure it's very, very similar to that. And I can tell you, it didn't bother the cat, that's for sure.
Right? Yeah.
So you're a nurse by trade.
Yes.
What types of nursing performance have you done over the years?
Well, I started in the medical field at 15.
Whoa.
My mom owned adult care homes in the area, and that was my first job, working for my mom, taking care of elderly with Alzheimer's. Then I got my certified nursing assistant, and I started working at the hospital. And then went on, got my licensed practical nurse.
Perfect.
Worked for local pediatrician's office while I continued getting my nursing degree. Started working at the hospital in 98.
Wow. It's quite a while ago.
Yep.
So with
Seems
all
like a
these
long time ago.
experiences, were you a local?
I was born and raised in
Born and
Prescott.
raised.
I'm impressed
I
to
am
be
too. Look
adjacent
what we
to
have
a
in the
local.
middle
Yeah.
of us.
I never left.
Hometown local girl right here.
Yep.
Great.
And then you have 3 boys.
No, I have a boy and 2 girls.
Oh, a boy and 2 girls.
Yep.
Okay.
Yep, boy and 2 girls, teenagers. Well,
Oh,
my
boy.
oldest is going to be 21. I don't
Wow.
know what happened there.
You
but
must have had kids when you were 12 then.
yes.
Right
Yeah.
before you started
Yeah,
your
'cause
job
I'm
at
only
15.
30.
And then your husband works for the City of Prescott Fire.
Yes.
We know Scott Luedeman, all of us do.
Hi,
So
Scott.
Hi, Scott. Hi, honey.
So one of the things we're just talking about kids, and that brings up a good question. Is there an age requirement
Oh,
or
good
limitation as far as
question.
people coming in on both ends, young and elderly?
So the youngest person I've done an IV on is 14. I would say I would go down to 12 as long as they're willing
And parents are there.
and parents
Yes.
are okay with it. But I have done some younger teenagers for different reasons. The oldest is 96.
Wow,
Oh my gosh.
very cool.
Yeah. So anywhere in between, there is some restrictions to whether you can do an IV on a client or not. And if they have congestive heart failure, then you cannot, or kidney disease.
Gotcha. So did the 96-year-old come in for detoxification from a hangover?
Right.
Yeah,
Just questioning. So as far as the young side, though, so anyone under 18 would need a parental waiver or signature?
Yeah.
Okay,
Yeah. And usually their parents are there or
Sure.
their parents bring them in.
very good.
Yeah.
I'm probably correct in saying this, but this would not be a health therapy that's covered under insurance.
No, it is not
So
covered
it's-
under insurance.
It's all cash pay.
Cash, yeah. We do
Covered.
take flexible spending cards, so FSA, HSA cards,
Okay.
and insurance is not on
Right.
board yet, but
I bet
we're hoping someday they will.
I'm sure someday they will when they see what it's doing to help life and keep people healthy.
Well,
Right.
and it does cover, health insurance covers it when you're in the hospital. So,
Yeah, and this is way cheaper than
yeah,
Than
so
a
this is just
hospital.
an
emergency
extension.
room
Yeah,
visit.
exactly.
What about, so you do it in your office? What are your hours of operation?
Right now it's by appointment only,
Okay.
but we're open Monday through Sunday.
Oh my gosh.
Wow.
Yeah,
And you said 8600 address?
8100.
8100.
Yeah.
Whereabouts at on 69 would that be?
So that's on the frontage road
Uh-huh.
in between CVS and Dairy Queen.
Oh, okay.
Yeah.
All right, where you'd
Oh,
be.
I drive by it every day.
Yep.
I'm going to have to, Jamie.
Yeah, come see me.
So IV therapy, it just seems to be really an up and coming thing,
hmm
which shows you, I feel that people are becoming more serious about wanting to take care of them.
Good health.
After
Yep.
all of these years of abuse and potato chips and white bread.
Yeah, yeah. And IV therapy's been around for years. It's just getting the rest of us on board.
I know.
But they've been doing it in naturopath's office for years, and the high dose vitamin C for different ailments.
Now, the B12, when you take that vitamin, oh my gosh, that's the one that just turns you all yellow.
B12,
Yes, isn't that in
B complex
B
is
complex
yellow.
is
Yes.
yellow. Ah.
And it's very strong.
Yes, it is. Okay, so is that in any of our therapies
That's
here?
in pretty much all of mine.
All of them.
Yeah. And a lot of people can taste it, can taste the B complex.
Wow.
Oh, really? Huh.
Yeah.
But
when
don't
they're
worry,
getting
you're
it
not going to turn
infused.
yellow.
No.
Don't worry, you're not going to turn yellow.
Nope.
We have to take a break. That's what the engineer is saying. That's what that means. So, listeners, we'll be right back. My wingman, Mike Enders, Bentry Custom Homes. Our guest, Miss Jamie Luedeman, owner of a Better You IV bar. We're talking IV therapy this morning. So don't move. We'll be right back. Let's wave at our audiences. You're back on air with Hammer Time. Sandy, Mike Enders, Bentry Custom Homes, and Miss Jamie Luedeman, owner of a Better You IV bar. So when we were on break, Jamie, we were talking about like IV therapy to go. You would go to an office.
Mm-hmm.
Do you do multiple people in an office?
Yep.
You do?
There's a couple local businesses that I go to every month, and they all know me.
Hi.
And yeah, they pre-schedule so we know what
Right.
each one's getting, and if they're not sure, we'll talk about it. But yeah, they keep me running because I'll go do a handful of people at the same time, and then monitor all their infusions, and yeah, and then they can keep working.
I
good.
think so. Do you think that that could happen, Mike, with our contractor industry? I'm lining up the guys. Come on in. Dirty boots, jeans. Come
I
on
think you got to
in.
start with our board meeting.
Oh, would that not be awesome?
So
you
we,
go.
we meet at 7 o'clock. Jamie comes in at 7:15. We all get hooked up, and we're done by 8. Meeting's over at 9. We all leave very happy.
And
Yep.
healthy and ready to go seize the day.
You have your infusions while
Yes.
you're doing your meeting. Yeah, and speaking of contractors, they work outside in the heat
Oh,
all
Yep.
summer long, and I do have some contractors that come in because they just feel dehydrated and depleted, and they leave feeling so much better.
Wow.
I mean, I can only imagine, and it's got to be worse certainly down in the valley.
Yeah.
But for people working on a roof, for example, or contractors that are working on paving crews, I mean, that's just got to suck the moisture right out of your body.
Right.
So I can see where that'd be very,
Yeah,
very
and then
helpful.
we can replenish all the electrolytes. I mean, you can take Gatorade too, or Pedialyte.
But it does take time to absorb through your system, and
Yep.
digestively, is it absorption-wise from something like a Pedialyte or any of the energy drinks? How much of that gets into your system?
That's a good question. I mean, I think your body absorbs it, but
Gotcha.
it's a lot quicker You
Yeah.
feel better faster
Gotcha, because I'm
with an
just
IV
still,
infusion.
still amazed at only 40% of
I know the
oral
vitamins.
oral
Yeah.
medication.
So then you take in people with digestive issues. So
Uh-huh.
if you have Crohn's disease,
Mm.
um, gastritis, anything that has inflamed your GI tract or your stomach, then your body absorbs even less.
And so your IV therapy is able to treat some of those folks with those conditions.
Yeah, gastric
Wow.
bypass. Your body doesn't absorb, especially the B vitamins.
I hate
So-
that B complex. I don't like that one. So,
Good stuff, though.
yes, it is. So I figured if your vitamins only are 40%, you're going to have to take a triple dose to get at least 100% absorption.
Yeah, you could, but you don't want to overdose either. I had somebody call me who overdosed on vitamin D, and vitamin D is a fat-soluble vitamin, so your body doesn't urinate out the extra.
Huh.
So you got to be careful
Interesting.
with your
So
your
does that
vitamins.
stick in your liver then?
Yeah, it sticks in your body, and then it can cause effects.
Huh.
So
Interesting.
I told her to go to the emergency room.
Ooh, right away.
Yeah.
Yikes. How about, so do these injections, would they treat and help offset flu?
They
as
can.
Well, they
yeah.
can.
Yeah, they can help your body fight it. Just increases your immunity.
Wow.
Yeah.
For anything and everything. Because look at the world we're living in nowadays with all of these allergies and the tree growth and the car fumes and the work conditions and the COVID virus. I mean, it's just all over us.
Yeah. And
go ahead.
I have an infusion for allergies or sinusitis. If you have chronic sinus issues, then I have an infusion that helps that. I have one client who gets it every month, and it's helped her sinuses tremendously.
Oh my
She doesn't
gosh.
get sinus headaches anymore. The bags under her eyes are less. Yeah, so that one helps her a lot.
So would it help Sandy in her recent audio commercial about the fungus among us? So
Uh-oh.
You heard our radio commercial.
I did. I thought it was
Pretty
very good.
cute.
Very good. So I do have a legitimate question, or
Yeah.
legitimate to me. Can you explain what the difference is between the vitamin B complex and the vitamin B12?
So vitamin B complex helps with, they both help with energy.
Uh-huh.
And then they both support cells. Vitamin B12 helps more with, just everybody thinks of it, gives you that extra boost. B complex helps with metabolism.
Uh-huh. Okay.
So they both have very important roles, but similar but
Similarities.
different.
Gotcha.
Okay, so here's a question. Can someone come in every month and get a different infusion, or do you suggest that they stay with the same infusion? Probably not, because we're changing.
Yeah, no, I think that if they find one that works for them,
Okay, then stick with it.
then stick with it. But it's okay to try different ones, and I have clients do that too. It's like, well, let's try this one this month. I'm like, okay.
Okay. That would be me. Let me try this one.
Yeah, and then whatever one makes you feel the best, then if you want to keep doing that one, then great.
Do you take your IV injections yourself?
I have, yeah. I want to see what my clients feel.
Okay.
Very good.
Very good.
Yeah. So I have tried most of them. I haven't tried all of them because I don't typically get migraines.
Right.
But I do have to say, I finally got allergies about 8 years ago after living here my entire life, and I've had to take Zyrtec and
Nothing works. It's terrible.
no, but I haven't had to take anything this year
Really?
because I've been doing infusions.
Wow.
Not saying that'll happen with everybody, but
Boy, you heard it
I'm a
right
believer.
here on Hammer Time. A believer with IV infusions for allergies.
yep.
So I do have a technical question in Sandy's behalf. If it was on a Friday evening when you were treating her, could she we enjoy a slice of pizza and a glass of wine along with the infusion?
Sure.
Okay.
Yeah.
Phew.
Just looking out for you, kiddo.
Phew.
Yeah.
But
of
in all
course.
seriousness, there really isn't any interaction as far as
Food.
if they come in and have an injection and then want to go out to dinner or do anything, activity or whatnot, shouldn't be.
No, no. And the funny thing is with the B complex, and that's in pretty much all of my infusions, because it does help with digestion and stuff. I hear everybody's belly start gurgling about 3/4 of the way through.
Just feed me, feed me.
Yeah.
And so you're open by appointment only?
Yes, for now.
Okay. How many of you are in the office?
Well, it's just me doing IV
Okay.
infusions right now,
Okay.
but I am in the works of hiring a couple nurses that I've worked with forever.
Perfect.
I
Good.
want to make sure
Terrific.
you have good
The I-
staff.
The IV injection is to go.
Yep.
You can cover a broader range and more territory.
Yeah. Yep. So they'll be up and running probably in the next week or two.
That's great.
Mhm.
Terrific.
I'm really excited to think about the possibility of how this would really help the industry and these guys that work so hard.
Yeah.
You know, and the firefighters. We don't ever think about the stress that's coming down on us.
Right. Right.
So,
And they do, like the Myers cocktail. Everybody I talk to, they just sleep so good that night, and the magnesium just helps relax them and relax their muscles. And
I'm going to try one. You heard it here on air. I'll let you know what happens.
Good.
We should have really thought about doing it on air. Would that not have been
Get all
really
hooked up.
cool?
There you go. Next time.
Next time. So, Mike, does this not intrigue you?
Yeah, well, it does. It does. I'm looking at all the different things that you can infuse, and so I would have to have a 15-minute interview so you could tell me what's the best thing to treat my multiple deficiencies. But in all seriousness, sometimes, for example, if we've been up at the lake and we come home on a Sunday, I'm dragging because of all the heat. Even though you try to hydrate, it still
You
sucks it
can't
out
do
of you.
it.
Oh, yeah.
And
No, it
so
does.
this is great to
Definitely.
know.
Yeah, you get busy and exhausted and you forget to drink. And
Yep.
sometimes you just need that extra boost.
Perfect.
Yeah.
And then you don't even think that you're thirsty in the summer out in the heat.
Mhm.
It's like, oh, I'm not thirsty. I don't, but you totally are,
Mm-hmm.
and it doesn't register that
Yep.
you need water.
Right.
So,
Yep. And then you get that migraine
Yep.
and not feeling good, and that's all because you're dehydrated.
see, we have to take a break. Okay, engineer. Mike, take us to break.
It would be my pleasure. We're having a great conversation all about the Better Served or Better You IV bar, and we're learning a lot. So please come back after our short break. We'll have some valuable messages here while we're off air, and we'll be right back.
This is so cool. I'm so excited. I'm going to do this. You're back on air with Hammer Time, Mr. Mike Enders, Miss Jamie Luedeman, a Better You IV bar, a injectionist, infusionist, an
Yes.
IV therapist.
Right.
YCCA Sandy, your YCCA girl. Before I forget, I do want to let everybody know you are welcome to call YCCA at 778-0040. You know, we're here to help the community, Mike. You know that. We do a lot of, we do intervention, but not with IV cocktails.
But Sandy does have a lot in her toolbox as far as referrals, ways that you can go about accomplishing things. So don't hesitate to pick up the phone and give her a call.
Problem solving, we look at complaints. This organization is seriously here to help you, our consumers. So I say I'm connected 24/7. You're welcome to call. We're always here for you, the community. So, Miss Jamie, you do events. Let's talk about IV therapy for events.
Okay. Yeah, so I do anything from weddings, bachelorette parties, office events, you name it, we can do it. athletic events.
I'm not so sure about a wedding party. I mean, do you infuse everybody before the wedding or after the wedding?
I have done before. Yeah, the bride. I wish that I was doing this when I got married because I was so sick on our honeymoon.
Wow.
Wow.
Yeah. So if I had a little immunity boost, maybe I wouldn't have been sick. But you just wear yourself out. So I have done rehearsal dinner. I've done the morning of while they're getting ready, just to kind of give the bride an extra boost.
Interesting. So now, what's the difference? I think I know, but here we have IV infusions, and then we have injections.
Yes, so the infusion is the IV fluids with the vitamins
Right.
and minerals inside. And then injections, yeah, we just offer injections like
Separate.
B12. Yeah.
Okay.
Yep. Or if there's not something that you want on your IV infusion, we do IV add-ins. So, yeah.
And legs have a little extra dollar amount to be an add-in.
Yes.
Okay.
Yeah. If
So-
it's something extra than what's on our.
Right, so everything that you've got listed in the injections actually goes into the infusion bag.
Yes, almost
Gotcha.
everything. We do a weight loss injection, but that one does not go in your IV bag.
Gotcha.
Some of
Okay.
them are IV push
Ah, okay.
or have to be injected.
Did you just think about this overnight and that's what you wanted to be, or you were seeing what was happening and you felt like creating this new healthy business to help so many people?
Well, it's always interested me. To be honest, I saw the first mobile IV place in Phoenix years ago, and I was like, oh my gosh, that's genius. Because, I don't know, like being a nurse, you see people with the stomach flu, and all they need is some IV fluids and
bingo.
Zofran. Yeah. Zofran helps with nausea and vomiting, so you put some of that in there, and they feel so much better, or even just a shot of Zofran. But yeah, so just seeing more, and with COVID, the needs, nobody wanting to go to the hospital.
Mhm.
It's just a different way to help people.
I love the name, A Better You IV Bar. So was that your inception, your creation?
Well, a Better You IV bar is, but I have to work under a medical provider.
Okay.
So my nurse practitioner owns a Better You Med Spa, and with us collaborating,
perfect.
we just thought that name was good.
I think that's excellent.
Yeah.
Excellent.
So you can make an appointment, listeners, to go to A Better You IV Bar. You can meet the most awesome Jamie. She can hook you up,
Yep.
inject you, fix you up, make you feel better. And share your address again, Miss Jamie, for our listeners and how they call and make an appointment. Plus, you have a super cool website.
Yeah. So our address is 8100 East State Route 69 in Prescott Valley. Even if you live in Prescott, don't forget we can come to you or Chino or anywhere. We come to your office, your house, and then you can call 928-421-4292. And if you're not sure if it's right for you, just give me a call and we can have a conversation about it.
That's
Good
perfect.
idea.
Yeah.
Good
That's
idea.
a great idea.
Now, is there a geographic limitation as to how far you'll go? What your preference is?
If I have to travel to Paulden,
Uh-huh.
which I've done before, but I do tack on a little extra travel fee,
Understand.
or like Mayor,
Mhm.
Dewey out there.
Okay.
So you do have regulars that call you for a couple times a month or every other month.
Yes. Yeah.
That's
Yeah. Once they
amazing.
see how good they feel, they keep coming back. Or just as if they need it, then they call. So,
Terrific.
yeah.
I guess how do you know you would need it? I guess if you were feeling kind of down and funky and not
Not your usual
not
self.
your usual self.
Yeah. Getting over,
The
the
cold
flu,
or
cold.
flu.
If you have the stomach flu, we can get you feeling better faster. Why throw up when you can get some medicine?
And not throw up.
I hate throwing up, so
I
I'm
hate
all for
throwing
it.
up.
So
Mike, do you hate throwing up?
that's not my favorite. So with Sandy, the way that she'll know that she's ready for one is if the bruises start healing on your arms from bouncing off the wall.
No, I just can't help it. It must be. I think it's my vitamin. It's my fish oil. I say it's my fish oil.
Well, it's-
and now I'm going to have to quadruple because only 40% is absorbed.
Well,
Good
it's
gravy.
admirable. You have a lot of energy, and we're all envious of that.
Yep.
So, listeners, we have had the best program this morning with Jamie Luedeman, owner of a Better You IV bar. And I say, if you need to be rehydrated, you want to restore, you want to recover, and you don't want to throw up. You don't want to get sick. Go see Jamie.
Yep.
She'll do a better you.
Make you a better you. Yep.
That's
Absolutely.
awesome. So, Mike, which one are you going to get?
I think just the I
Let's see
like
what
the
he
idea of
says.
the Myers cocktail actually.
Okay, so that is IV fluids, magnesium chloride, glutathione, vitamin B complex, vitamin C, and vitamin B12.
Did you say potassium is in there?
No.
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 Potassium.
Because sometimes I get the cramps, night cramps in the backs of the legs.
So
or
the
calves.
magnesium would help with that.
The magnesium.
Oh,
one. Super.
there you
Yep.
go.
So I'm
Here's your
good for the
little
Myers.
There's
Okay.
your Myers cocktail.
Yeah,
Sign me up for a Myers.
Okay.
The Myers and the Immunity are the most popular.
Gotcha.
Okay, the immunity, IV fluids, vitamin B12, zinc, vitamin C, and vitamin B.
Vitamin B complex. Yep.
Oh, I don't know which I'm going to, I don't know. I'm so excited. This is like Christmas.
So we're going to keep everyone out there in abeyance and curious as to what Sandy decides. So we
Right.
will let you
we'll
know.
let you know what I decide to be infused with. So we love you, listeners. Thanks for putting up with our our first ever, our mega podcast this morning. I hope it went well.
We appreciate you joining us.
Yes. So until next weekend, I'm Sandy.
Jamie.
Oh, the engineer
Bye.
says no, we're not leaving yet. Oh, we have to take a break. We'll be right back. Forget that we said until next weekend. Don't move. Okay, welcome back to Hammer Time. We're going to get it right this time.
There we go.
Good gravy. So thanks for joining us. As I said earlier on our initial first ever podcast, hope you enjoyed it. So until next weekend, I'm Sandy.
I'm Jamie.
I'm Mike.
And together we say, a better
A
you,
Better You IV bar.
Can you tell this wasn't scripted?
So address and phone number.
8100 East State Route 69 in Prescott Valley, offering mobile IV services also. Phone number 928-421-4292. Give me a call.
So remember, infusions are a safe and effective way to deliver fluids, nutrients, and vitamins right into your bloodstream.
And I say rehydrate, restore, and recover at the Better You IV bar.
Jamie, thank you. We love you. It was a
Thank
great
you.
program. So bye, listeners. We love you.